I guess one topic in rare disease is very clear. We can increase educational level, but it's a question how many doctors do we address with that? Maybe 1%, 5%, 10%? The overall majority of the doctors are not really interested or not open-minded in the rare disease because, again, they are getting educated during their university time in the sense of focus on the frequent disease. So we are clearly convinced that we are only able to change this massive gap in the proper diagnosis of the patients if we are changing the system how to do diagnosis. And that means the analysis for the rare diseases cannot be at the end of the diagnostic path in the sense of I've excluded all of the diseases and then maybe at the end of the path I might think about rare diseases. But that's still the fact. So we can only change the story of the patient in the sense of the analysis for the rare disease has to be part at the very first step in parallel to analysis of the frequent diseases. And how can that be done? We are convinced there is one technological platform. It's called tandem mass spectrometry. It's a very robust, super sensitive technology. We're in the meanwhile in the femtomolar sensitivity, so we can definitely measure extremely low concentration of specific molecules in the peripheral blood. And the very nice characteristics of the tandem mass spectrometry is the fact that you can multiplex it. It means for some very few bucks, you can test not only for 5 diseases or 10 diseases or 50 diseases, you can test for 500, for thousands of different diseases in parallel. The only job that you have to do as a prerequisite, you have to characterize the individual signals you are measuring with a mass spectrometry. A little bit like a fingerprint for each individual disease. Once you have done it, it's an extremely cheap, super robust game changer because it gives you the chance to diagnose the patient at the beginning or exclude that the patient is suffering from a disease at the beginning. And this is really a chance to improve in the future massively the fact that the patients are still so lately being diagnosed.